Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a blocked right ear, and the ears are blocked with dead skin, dead keratin, and it was layers upon layers of dead skin. So this more of the lateral dead skin had dried and solidified, and there's almost like a crust. So I'm just using the ear pick to break through this more drier dead skin. You can just see how dry and textured the skin is. And I was quite surprised to see how much dead skin there was actually. And at the end, when we approached the eardrum, there was some dead skin that was still attached to the eardrum itself, in addition to some granulation tissue, which is inflammatory tissue. So granulation tissue normally indicates there's been some trauma and there's some healing going on, and it's a combination of connective tissue that then has its own blood supply. So it undergoes a process called neovascularization, and quite often when you're removing earwax and you come across granulation tissue, the granulation tissue can come away and it looks like flesh, and whenever I see granulation tissue, the hairs at the back of my neck stand up because it's kind of bumpy, red, moist, and you can actually see the blood vessels quite more often than not. So I'm also using the new ear correct there, and I thought when I removed that was job done. I cleared the ear, but as you can see, they've got this keratin that's oxidized. It's been there for a while, and it's lodged against the eardrum. And I think at this point here, the patient felt it to be a bit uncomfortable. So it made me believe that it was attached to the eardrum. So I think in a moment I'm going to use some olive oil spray just to lubricate the canal wall, and hopefully that allows some of that oil to seep in between the dead skin and the eardrum itself. I think I've just put some oil in here. I'm just suctioning the excess. So this is not keratosis obstruans. Keratosis obstruans is when you present with otalgia, so ear pain, and more often than not, there's a global widening of the osseous part, so the bony part of the ear canal. So the theory is, as this plug of dead skin expands and compresses against the canal walls, sitting underneath the epidermal skin that lines the bony part of the ear canal and resting directly on top of the bone itself is a thin sheath or membrane called periosteum. And that supplies the bony part of the ear canal with all the blood, nutrients, oxygen that it requires to sustain life. And that irritation of the periosteum caused by the compression of the skin plug initiates specialist cells that sit on the surface of the bone called osteoclasts. And these osteoclasts, what they do, they break down the bone into its constituent minerals, and it then redistributes these minerals through the bloodstream to other parts of the body. So it's basically taking away bone. It's degrading it, it's breaking it down, and it causes, of course, then the ear canal to widen because there's less bone present. Another theory of keratosis obstruans is the pure pressure itself that expands the bony part of the ear canal. So there's probably two mechanisms that with keratosis obstruans what causes the global widening. They call it, the technical term is remodeling of the ear canal itself. So this bit of dead keratin is still on the eardrum, so I'm just peeling it away. I think I'm going to put a bit more oil on. And you may already see some granulation tissue, so I just put some oil there to lubricate it. To the right hand side, I'm using the fine end suction probe here. I don't want to over suction this skin because it is still attached to the eardrum. I have to be really gentle and delicate here. And as I'm peeling, it's a bit to the left hand side of the hammer bone, just there. I'm trying to peel downwards as opposed to peeling directly away. That's going to minimize any possible trauma to the eardrum. So at this stage, the patient did feel that the hearing was significantly improved, but they didn't feel it was 100%. And then we've got this main central piece of keratin. So this is just pure dead skin. and this skin was formerly lining the eardrum. So our ear canals is lined with skin, and the outermost layer, the epidermis layer, as that dies and sheds and replaced by another layer of skin, that skin undergoes a process called epithelial migration. It's like the wildebeest, the great migration of the wildebeest. The skin migrates from the center of the eardrum, because the outer layer of the eardrum is made up of epidermal skin. I'll come back to that in a moment, because you're going to see some granulation tissue just, I think at this point, you can see it there. I've just paused it and trying to slow it down so you can see it. And underneath that, you can see that the removal of that granulation tissue has disrupted some of those blood vessels that has formed part of that granulation tissue. So there's no active bleeding there, but where the granulation tissue is, it's just ruptured some of the blood capillaries, so that it's kind of within, it's still encased within the granulation tissue itself. So I've invited the patient back in a couple of weeks. They're going to use some acetic acid spray just to see if this resolves. If not, I'm going to refer the patient to their GP. So they should be back next week. So hopefully I'll take another video and I can upload it. I can add it on to the end of another procedural video. And we'll see what it looks like. So I'm just mopping up some of this dead skin now. Some of this dead skin, the reason why I'm removing it is I just want to make sure there's nothing sinister underneath. It's been several times actually that it's come to surprise me that when I've peeled away a blanket of dead skin like this, that underneath there's evidence of either benign osteonecrosis or the much more rarer condition, canal cholesteatoma. And that can sometimes be triggered by dead skin that's resting on the ear canal. This dead skin, as it dies and decays, it releases lysosomal proteolytic enzymes. And it can essentially start, these enzymes can start chewing away and eating away at the skin, so it can cause an ulceration. It can then lead to periosteitis, an infection, inflammation of that periosteum that I referred to earlier. And it can then start causing necrosis of the underlying bone, and then finally sequestrium of the bone, so the separation of bone. And it's just been, I think it's several times where I just removed some, what I believed initially to be some innocuous piece of dead skin, living underneath that was some evidence of some other underlying pathology. And if you look at the centre of the ear canal, there is a bit of a dip there. So this patient could potentially have very, very early stages of benign osteonecrosis. I wouldn't say it's a canal cholesteatoma because there's no discharge infection there. So just having a good close-up of that granulation tissue on the anterior inferior quadrant of the eardrum. That's all the dead skin that I removed. So the patient could hear significantly better. Just going to get them back. I think they're coming back next Friday, so I'll keep you guys updated. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.